You're looking at a rare commodity in England's hospitals. Here at Warwick A&E, they are one of only 5 NHS trusts to meet the waiting time target in these latest figures, and say it's all about the system as a whole.
There's 3 elements to it. It's the community before patients get here, it's A&E itself working well, and then it's the hospital needs to work well as well. So our acute physicians have worked incredibly hard to make sure that all of the emergency medical patients are dealt with really rapidly and discharged at the right time for them.
Across all hospitals in February, 87.8% of patients were seen within 4 hours, the lowest figure since the 95% target came in 2004. North Middlesex University Hospital NHS Trust had the worst performance, with only 67% of patients seen on time. Countrywide, the non-emergency 111 phone service and ambulance response times also failed to meet their targets. NHS England say the figures reflect in part the winter flu spike and that there was a significant increase in the number of calls to the ambulance service in February compared to the same month last year. Against the backdrop of the junior doctors' dispute, this is more pressure on the NHS.
Morale is at rock bottom, and my concern is if we have doctors which are leaving as a result of the dispute about the new contract, this is simply going to make the situation worse.
We are seeing services really on their knees at the moment, and really not being able to give the sort of support to frail older people that they need, I'm afraid.
Health bosses in Lancashire say Chorley Hospital A&E will close temporarily because there aren't enough doctors to staff the service. Waiting times are working in Warwick, but staff say some patients come here when they'd be better off at their GP or pharmacist.
It's part of British culture now, isn't it? The 4-hour standard. We're all aware of it. I'm sure most members of the public know about it. And one could argue that it creates perhaps more work, because if we're successful, then perhaps people choose that as an option.
A&E never works in isolation. The NHS says the figures were compounded by a large rise in hospital discharge delays caused by issues in the social care system. Peter Lane, 5 News.